Okay, everybody, let's take a look at case scenario number 2. If you want to go ahead and press pause real quick and take a screenshot or copy down the scenario, and then you can follow along. Okay, let's get going. Okay, here we have Leonore, who it appears she has been very sad, feeling very sad since her husband died 12 days ago. So this is going to be critical. We have a couple of things here. Obviously, we have this symptom here of being very sad, which is well within the realm of some sort of depressive disorder. And then we have this time frame here. We have 12 days ago. So 12 days, that's really recent. I mean, it's less than 2 weeks. So that's something that we really have to consider at this point. So that we have a depressed mood, and then we have the event that the husband died. So we have a death, and then it's less than 12 days, or just barely 12 days ago. So this information here is critical to us at this point, because just right off the bat, we should be considering with death, this is considered either bereavement at this point, or some sort of adjustment disorder or a depressed mood. That's kind of our options that we have at this point. So we're either looking at major depressive disorder, we're looking at adjustment, or some form of bereavement. Those are the ones that I would say we're looking at. We could, if indeed it came to it, we could consider at some point, some sort of acute stressor, almost like a PTSD. If that were to be involved, that might be another thought of mine. But I would usually only include that if the scenario really indicated that. But as of right now, this is kind of what we're looking at. So let's move on. Let's move down here and see. It looks like she's eaten very little, which is very common with depressed mood. So the appetite has gone down. And then she's also having difficulty sleeping. So again, those two symptoms, very, very common with depression, also with anxiety. So appetite typically goes down, sleeping, difficulty sleeping and adjusting to sleeping, particularly if it's only been 12 days. And then let's move down to this next. It says she is weepy most of the time. So we've got a couple of factors right here. The term weepy, again, indicates a form of depressed mood. And then this helps us understand where she's at with this idea of most of the time, which is a key phrase. So this is kind of more often than not, that's typically an indicator for depression or depressed mood. So we know that definitely she's experiencing depression most days or most of the time. And then let's continue on. It looks like Leonore is preoccupied with thoughts of her dead husband. So that preoccupation is kind of an interesting symptom right there. There's almost a form of rumination, where there's some ruminating going on. That's something to consider. That definitely would be common with depression, certainly with some form of anxiety. Typically those who have recently lost a loved one or lost somebody close to them, 12 days, they're well within kind of what I call the shock period. So they're really very disoriented. Many folks are just trying to push through the first week or so of the funeral and signing papers, and just there's so much going on that I've talked to so many people that they just feel disoriented, or they're almost in a state of shock where it's just numb. They're just moving through the actions, getting things taken care of. It really is about this period of time, about a couple of weeks later, when the emotions really start to set in for a lot of people. And so this idea of rumination or preoccupation is certainly well within the range of normal bereavement type of symptomology. So there, let's continue on. It says that she doesn't want to do much other than think about him. So that's an indication also somewhat of almost in almost in the fact of along the lane of, let's see, of anhedonia. She doesn't want to do much, right? That's kind of the key phrase here that we're looking at. So there's anhedonia going on, there's depressed mood going on. She's also doing something very, very typical. She's declining invitations to friends and spends most of her time alone. So that's also very common. There's a social withdrawal happening, especially those who are going through times of bereavement. This is really, really common. In fact, I have clients here just over the past 6 months that I've been working with, and this is almost verbatim what this particular individual is going through. Just declining invitations. She acknowledges that her friends and family are trying to get her out. It appears this is the same, that friends and family are reaching out to get her out. Again, great intentions. I always kind of explain to clients that it's important to acknowledge that their intentions typically are genuine, right? Although they kind of fall flat, and it's just usually not the time and the place for the client to want to do any of that stuff, but certainly extending the invitations appropriate and normal behavior from friends and family. So she's declining the invitation. And then here's this last phrase, she's spending most of her time alone. So social withdrawal goes quite a bit with isolation. So this is where things get a little bit tricky when it comes to bereavement, because these are very common, that people begin to withdraw, they begin to isolate from family, from friends, and that actually kind of starts to get the cycle rolling of them headed towards kind of deeper depression. All of this, though, as of right now, appears normal. There doesn't appear to be any sort of post-traumatic stress. There wasn't a severe kind of car accident or something that she witnessed her husband's death. At least it doesn't say that here, or that she was threatened with death. So we can kind of take PTSD immediately off the table. Major depressive disorder, it's been 12 days. So this kind of helps us understand that even if we were to consider major depressive disorder, it's still falling short as far as the timeline. So I'm going to go ahead and kind of rule that out. As far as adjustment disorder, that could take place. It could be an adjustment disorder. However, something to consider here is that adjustment disorder, part of the criteria is that it is kind of significantly marked distress kind of outside what is normally to be expected during a given kind of life transition or adjustment. So it really doesn't say that there's something that's out of kind of any sort of clinically significant behavior at this point. It shows that she's weepy, she's not eating much, she's difficulty sleeping, social withdrawal. That's well within the norm of common bereavement symptoms. And so I would just say that at this point, adjustment disorder is likely not kind of the appropriate or main diagnosis, just for the fact that there really isn't marked distress in at this particular moment as far as marked distress in behaviors. Lastly, another main criteria with adjustment disorders is that it's impairing other areas of her life, such as job and other areas. There's some indication that with the social portion that there kind of may be some impact, obviously, on social, but it's only been 12 days. We're not seeing that it's completely isolating her from, shopping and other sort of activities. So based on that, I'm actually going to take adjustment disorder out of the running for right now. That leaves me typically with bereavement at this point, which I am going to go with this case scenario. So I'm going to highlight that this case is bereavement. It's not, this definitely wouldn't be like complicated bereavement or prolonged bereavement. Prolonged bereavement requires about a year's worth, about 12 months worth of grieving over an individual. So certainly we can also rule out prolonged bereavement. Bereavement typically, it used to be in earlier DSMs, they'd talk about an average of around 3 or so months. That if an individual is well within still kind of normal bereavement behaviors, that 3 months is about right. If it's drifting now towards 6 months, the depression is deepening. It's now impairing social occupation, other functioning, family functioning. It's likely headed towards a diagnosis. At that point, if it's more often than not, there's still a lot of rumination. It's probably headed towards major depressive disorder, or even considering an adjustment disorder at that point, one of those two. But likely if it's really intensifying after about 3 months, clinically I'd probably head towards major depression if it continues to fit. Let's see. So the code, if we're coding this, this code for bereavement, it's actually what they call a Z code. So it would be here in my DSM 5TR, it's Z63.4, and it's called uncomplicated bereavement. And that's, again, typically it's a normal reaction to this stressor of losing a loved one or somebody close to that individual. There's really no signs of really, again, clinically significant impairment at this point. Everything seems to fit well within what's norm. So this is something that uncomplicated bereavement, as I said, is going to be our best fit. And we are considering this essentially no mental health illness per se. This is a life stressor or phase of life, and it's a Z code that's typically used. It's usually not billable to insurance, and so this particular client would be receiving services probably on a private pay basis, but if you were to try and massage this into any other diagnosis, it would be very difficult to justify based on the criteria and what we've identified here. It's well within what would be normal bereavement at this point. Okay, hopefully that was helpful. If you have any questions or comments, let me know about this case study. But that is a good one to know that this would be considered as we talk about the differential diagnosis steps. We get to the very last step of the diagnosis, which says, is this a mental health illness, diagnosable illness, or is this something else? Is this kind of normal adjustment or a normal life situation? And we fall to the latter on that one, that is well within the norm of phase of life issues. Thanks.